give me a heads up of Sam passing pictures, so I knew because of our relationship.
Because I knew you'd want to see Rob. I knew she would show up.
Still gonna go, not here.
And I could, so I had everything set up. I guess.
Wow, I had no idea. That was really something that happened.
There's a little bit of advanced stuff I gotta do, so I don't like, you know, just.
Yeah. Are we ready?
We are ready.
All right. So we have, getting back to the agenda here, we have 19 requests. Charles, do you have any introductory remarks you'd like to make? Charles Jones, our Chief Procurement Officer.
Yes, sir. Wait. Charles Jones, Chief Procurement Officer. Again, as Chair Ryder said, we have 19 items before you today. 18 of those items are contracts and procurements for one expenditure. Of those 18, 17 require responsive letters from the Office of Contract Compliance. We have 14 back with 3 in process.
Right.
Thank you.
So request number 1 and 2 are Cook County Department of Public Health. I don't see hearing who's presenting. Okay, so Marley Hendricks, our Director of Public Health Administration, is going to be presenting on request number 1 and 2.
Thank you. So this first request you see before you is a request to increase an existing contract not to exceed $110,578.93, running through the end of fiscal 26 in support of our lead abatement services. Okay. All right. I'll continue. Go ahead. Sorry.
So I was just going to ask if there were any questions. If not, we'll move to the next one.
All righty. So this next request before you is also a request to increase an existing contract not to exceed $44,801 through the end of fiscal 26 in support of our lead abatement services. Any questions on this one?
Any questions? No. All right. Thank you, Marley. We're going to go to request number 3, ambulatory services, being presented by Cherie Boyd, COO of Ambulatory Services. You get the table.
Good morning. My name is Cherie Boyd. I am the COO for ACHN. The proposed amendment extends the existing contract with Day Springs, Inc. for an additional 6-month period from June 1st, 2026 through November 30th, 2026. The amendment increases the contract by $1.57 million for Day Springs, Inc. It's also a MWBE. ACHN is requesting this contract extension to ensure uninterrupted janitorial and cleaning services for all of ACHN clinics. A request for a proposal is in process. The expectation is that the contract award process will finalize before 11/30/26. The contract award amount is to be determined based on the vendor submission. Any questions?
Any questions?
No questions.
All right, we're going to move to request number 4, which is being presented by our Chief Legal Officer, Ellie Bain.
This is a request to add additional funding to an already existing agreement with outside counsel Norton Rose Fulbright. They were brought in on an emergency basis on a lower amount due to a number of subpoenas that we have received that have required additional assistance. We simply just don't have the technology to handle significant subpoena requests ourselves within our team. The idea is to now give it enough funding to take us through to the end of the year. I have budget for it, so that's the request.
So one question, Ellie, why a Texas firm? Do they have some type of specialization in this space, or what's the rationale?
Right. So I'm in the process of contracting with a number of different outside counsel, but at this time I'm really limited in who we have agreements with. Norton Rose is the most across the board able to help us with different things. And so when the subpoenas came in, they also have the ability to contract at a lower rate for paralegals and electronic discovery. We had another firm that has a Chicago presence, and their rates were significant to the extent that they helped us with one subpoena request, and it was well over $160,000, and I simply can't do that. I just can't. Norton Rose is a firm that I was familiar with before. I've been familiar with a number of their attorneys for most of my legal career, so they were brought in to help us with something else. But because they were engaged, then I could use them to assist us with the subpoena.
Thank you, appreciate it.
I have some questions, but I feel like I've already pushed you a little bit too much today.
That's no, it's fine. That's why I'm here.
All right. Any other questions? All right, I'm going to move on to request number 5 through 10, clinical, being presented by Dr. Lauren Smith, our Chief Medical Officer.
Good afternoon, directors.
Good afternoon.
Good afternoon.
The first I have is an extend and increase contract with Getting USA. They provide us with intra-aortic balloon pump catheters, so to be used in our cardiology space. This is not to exceed the amount of $40,000 for a 12-month period ending June 30th, 2027. The next is an extend and increase contract with the Board of Trustees of University of Illinois, Chicago. This is grant funded HRSA funds, and they provide residency mentorship and support for our preventative medicine fellows. This is not to exceed the amount of $59,201 for a 12-month period ending June 30th, 2027. The next is an execute contract with Siemens. This is a one-time capital purchase from a GPO vendor. This is for equipment that will be used within our gastroenterology space, not to exceed the amount of $1,476,295 for a one-time capital purchase. The next is an execute contract with Merit Medical Systems, a GPO vendor, and this is for equipment that will be utilized within our cardiology space as well, not to exceed the amount of $360,000 for a 36-month period ending July 31st, 2029. The next is an execute contract with Stryker Sales. This is for one-time capital purchase, GPO vendor as well. This is for Sonopet ultrasonic equipment to be used in our neurosurgical and ophthalmological space, not to exceed the amount of $255,336.49. And the last is an execute contract with Penumbra. This is a sole source vendor, and they provide us with equipment that will be used within our cardiology space. This includes two one-year renewal options, not to exceed the amount of $225,000 for a 36-month period ending July 31st, 2029.
All right. Any questions for Laura before she? Nope. All right, great. Thank you. Requests 11 and 12 are being presented by Shannon Andrews, our Chief Equity and Inclusion Officer.
Good morning, directors. First item for me For our department before you is a request to extend and increase a contract with Medline Industries. They are the primary distributor for distribution of medical and surgical supplies on behalf of the system. This request is exercising the final renewal option allowed by the contract and a dollar value not to exceed $72 million, and it will take us through August of 2028. The next item before you is a request to extend and increase a contract with Deloitte Consulting on behalf of supply chain management for optimization. This request will take us through the end of the calendar year, December of 2026, not to exceed a dollar value of $860,000. The vendor will continue and finalize optimization for the day-to-day processing and policies for contracts and amendments.
Any questions for Shannon? Thank you. We're now going to go to request number 13, finance. Scott? Scott Spencer, our interim chief financial officer.
Yep, good morning.
Morning.
So this is a request for approval of an extension and increase for the contract of Chicago Lighthouse as a fiscal impact not to exceed $1,400,000 with a revised contract period extended to February 28th, 2027. This vendor provides telephone support services to our patients, specifically including overflow calls to provide scheduling, registration, and insurance verification assistance.
So we had a robust discussion on this in closed session. I know that there's a variety of different concerns around this contract as proposed. I have, during closed session, I communicated questions and concerns that I have about how we implement this contract. I also understand some of the other issues that I think that are out there in terms of where we're at posture-wise with this contract relative to when the extension and when the normal expiration occurred. I intend to, because of my reservations around how we utilize the contract, I'm going to abstain. I'll be recording an abstention during our roll call vote on this, and I will make that clear when we get to voting on these items. Are there any other comments?
I would just add that in closed session, each member of the committee had a number of questions, comments, and received responses from the team. And I look forward to a continuation of these conversations, including conversations which exist after February 28th of 27, when this extension will lapse if approved. Thank you.
Thank you. Any other comments or questions?
I concur with Commissioner Laurie's comments.
Thank you.
Thank you. Thank you, gentlemen. All right. We're going to now move to, thanks, Scott. We're going to move to request number 14 through 19, Stroger Hospital, being presented by Donica Austin Cathy, Stroger Hospital Chief Hospital Executive.
Thank you so much and good morning.
Good morning.
The first one is an extend contract with Interpace Diagnostics. This is for the molecular marker testing for thyroid pine needle aspirations. There's a zero fiscal impact, revised contract period 4/1 of 2026 through 3/31 of 2027. The vendor will perform molecular marker testing on thyroid nodule samples that show indeterminate results. This also helps to determine if patients have benign or malignant growth and if surgical interventions will be needed.
Keep going.
And next, we have an extend and increased contract with Professional Clinical Laboratories doing business as Alberta Laboratories. This is for histology services in the amount not to exceed $2,439,646. The revised contract period is 7/1 of 2026 through 6/30 of 2027. The vendor will continue to provide histological services, including but not limited to the tissue processing of cases, slides, immune histochemical stains, special stains, and genetic marker testing. And next, we have an extend and increased contract with Marquee Life Safety. This is for our annual life safety assessment for both Stroger and Provident, in the amount not to exceed $212,527. Revised contract period 9/1 of 2026 through 8/31 of 2027. The vendor will update the life safety drawings as a part of the Joint Commission accreditation process. Also, they will be surveying approximately 1,700 doors at Stroger and Provident. The facilities are required to document the annual fire smoke door inspections, which this vendor will perform on our behalf. And next, we have an extend and increased contract with Vitalant. This is for therapeutic apheresis services in the amount not to exceed $149,000. The revised contract period is 4/1 of 2026 through 3/31 of 2027. The vendor provides therapeutic apheresis services to our patients. These procedures include the therapeutic plasma exchange, therapeutic leukocyte depletion, and the red cell exchange. This request is a sole source as the services are available through our original service provider of blood products, which is Vitalant. And next, we have an execute contract with Nova Biomedical. This is for the products, glucose strips, control, solution, meters, and service for the lab. This is in the amount not to exceed $775,000. The vendor will provide the stat strip, the hospital meters, also the docking station for the point of care testing, both at Stroger and Provident. And our last one, we are respectfully requesting for expenditure approval for a vendor in the amount of $44,201. This is for Cardinal Health. There is an outstanding invoice payments were delayed as a result of the ongoing contract discussions with Cardinal. And there was a very specialized medication that was ordered as an emergent need. And we're respectfully asking for payment of this amount of the invoice that was dated 8/20 of 2025.
Any questions for Donica?
No questions for Donica.
All right.
I have a general question.
Sure.
Thank you, Chair. Charles, would it be possible on an annual basis for us to be given the percentage of vendors over the course of the year which have a presence in Cook County? Can we get that data somehow?
Yeah.
I'm sorry, repeat that again, the percentage
I'd
of
like on an
vendors.
annual basis to know, given all the vendors that we utilize over the course of 12 months, the percentage of those vendors who have a presence in Cook County.
Yes.
One of the ways to help the Cook County economy is to make sure that we're using our resources to support Cook County vendors. So that would be good information.
Yes.
So in order to make sure that we dial that in, Donica, you're good.
Okay, thank you.
Let's take a law firm, for example. A law firm could be Texas-based, but also have a Chicago office. So
And just for your information, Norton Rose does have a Chicago office.
And thank you for that, but this question is big picture.
No, so that's
Right.
the question.
That's why.
Would that count as Cook County, or are you looking for?
I'll take that. That will count.
And so vendors that have a physical presence in Cook County.
But what about our GPO?
Well, I
So
guess
that's a pretty significant, right?
it is, which is, again, this is more about information gathering than being accusatory.
So
Mine's for the GPO, and I get the import of the best price, right?
but those contracts too, have an impact, and even though not every contract resides itself here at Cook County, I mean, I think from your perspective, you're our board representative as well. I know that means you're our advocate too.
Absolutely.
So, you know, so anything that we're using through procurement, a percentage of vendors, a percentage breakdown of vendors that have a Cook County physical presence versus not. Is that something you can piece together for us?
I think we can work on the data and prepare it back, you know.
Charles, Monday is fine.
Knowing what I know about data, it'll raise more questions. Won't answer a question, but it'll raise more questions, but we'll be
Great.
better informed moving forward.
Yeah,
Right.
yeah. I guess that means you're not going to New York City with me this week.
There you go.
Thank you.
And if I may add, I think the thing about it, because Commissioner Lowry, you mentioned it before, is based on headquarters of the firms and all, nothing to do with MBE, WBE for Cook County, because all contracts go through that process anyway, regardless if they're local or not. Thank you.
Yeah, and I think this gets outside of even, this is a different dimension than the MBE, WBE. This is about.
Yeah, I'm not asking that this time.
Yeah.
But I might.
Dennis never got to this piece. This would have been something he would have lasered in on eventually. All right. Is there a motion to approve item 4A, contract and procurement items containing request number 1 through 19, subject to completion of review by contract compliance?
So moved.
Second.
Motion's been made and seconded. Again, I would reiterate and record it as abstaining from request number 13 based on the concerns and questions outstanding that I have raised during executive session. All those in favor signify by saying aye.
Aye.
Opposed? The ayes have it. Report of emergency purchases,
Yes, sir.
one being presented.
Yes, there was one in May, with the vendor Illumina Consulting Corp., 18 months, for not to exceed $149,000. This emergency purchase is for the vendor to provide coaching for the Leadership Forecast Series, which will provide comprehensive development plans for strategic self-awareness on behalf of the Department of Human Resources. That's it.
Any questions? All right.
Thank you.
Thank you, Charles. We're now going to move to items under the Chief Financial Officer, being presented by Scott Spencer, our interim Chief Financial Officer. These are important, Scott. However, we've used up a lot of time in this meeting, so just make sure you have a consistently consistently good cadence throughout the report, and we'll be good to go.
Be concise, is that,
And we'll start with the receiving grant file
okay.
award
Yeah.
items.
Yeah, so, thank you, good morning again. So we've got, 8 items here for just over 7 million. The executive sponsors, Mark Sprinka and Dr. Kiran Joshi. Any questions on those?
Any questions on any of those items? Hearing none, is there a motion to receive and file item 5A, the grant award related items?
So moved.
Motion's been made. Is there a second?
Second.
Motion's been made and properly seconded. Any discussions on the motion? Hearing none, all those in favor signify by saying aye.
Aye.
Opposed? The ayes have it. We'll move on to the May financials, and then we'll bring up our folks for the informational reports on the guidehouse recruitment update.
Okay, so we can flip to the next slide of May financials. Year to date, we are 61 million unfavorable to budget. You'll see on the next couple of slides how that breaks down between healthcare services and health plan. But just to summarize, net patient service revenue continues to be unfavorable by 2%, just under 2%. Capitation revenues favorable. And on the expense side, our variances continue to be on the claims expense, overtime, and supplies. The membership for the health plan continues to be favorable to budget, just under 3%. So on the next slide, again, walking you through some of the highlights here. The net patient service revenue short by 1.95%, but total revenues after adding in the capitation favorable by 5.16%. And then dropping down to the expenses, unfavorable by 7.33%, driven primarily by the medical claims expense, supplies, and overtime. So our combined net loss is 67 million. So if we flip to the next slide, we'll see how that number breaks out between healthcare services and health plan. The healthcare side, so the provider side, our hospitals and outpatient clinics, showing a small net loss of 6.6 million. In the health plan, showing a loss of 61 million. Thinking back to last month, the health plan was at a net loss of about 58 million. So one of the revenue adjustments that the health plan has been waiting for was booked in the May numbers, and that's associated with the retroactive risk adjustment changes for calendar 24 and 25. On the next slide, just highlighting again on the waterfall report, the favorable drivers in green and the unfavorable drivers in red, being again the net patient service revenue and the medical claims, and then on the favorability coming from the capitation revenue and our purchase services expense. On the next slide, on our so from a volume point of view, we continue to see momentum in outpatient and procedural services, despite softer inpatient utilization. Surgical volumes remain a bright spot, running combined 7% favorable to budget and 9% above prior year. We've seen particular growth at Provident coming from GI and ophthalmology, and then at Stroger, plastics and general surgery. Primary care visits are running just short of budget. And one correction that I wanted to point out on this slide that did not make the deck is on the specialty care visits, which are at budget for the year and better than prior year by 3.5%.
Yeah, what are plastics? I think I know, but you mentioned plastics.
Yeah, just within surgery, specifically what those the plastics are, I'm not entirely sure, but I think it's some sort of reconstructive procedure. Stroger.
Is the question, what surgery are they doing?
Well, the term was used, plastics. I'm not sure what that is. It's a broad category.
It incorporates a wide variety of, our plastics will do hand surgery, as well as, nasal fractures and other, so it can be a skin graft, it can be a wide variety that is incorporated in that umbrella.
So on the next slide, yeah, just showing our operating trends here. Not much to highlight here other than the outpatient clinic visits. We continue to project to be higher than prior year. Our payer mix on slide 8, we saw very little change during the month of May, a very slight decrease in Medicaid of 0.1%. Our revenue cycle KPIs on slide 9 did see a slight uptick in the accounts receivable days in total, and our accounts receivable days greater than 90, and so we continue to review the workflows within the rev cycle and focusing on how we can get that number back in line. Our charitable and public program expenditures, not much change from last month, projecting $686 million. Excuse me. Primarily driven by the top 2 lines, which is the traditional charity care and other uncompensated care. Our savings initiatives on the health plan side at just under 32 million of the 100 million of opportunity that's been identified between the revenue and the expense side. And then as far as agency expense is concerned, given our current run rate, we are tracking towards being able to save the 40 million that was budgeted, the budgeted decrease, that is. And then last but not least, on slide 12, again, is the county care slide showing the operating loss of 58 million as the health plan continues to right size. With that, I'll pause and see if you have any questions.
One question on the payer mix page.
Yes.
What I noticed, if we look from 2023 through the current one, 2026 May, we see it continues to increase with the uncompensated. That's not taking into account any of the federal rules that we have that are about to take place in 2027. So do you have any thoughts as to why we're seeing that continuously increase?
Well, so so the HBIA, so the Health Benefits for Immigrant Adults program was eliminated halfway through fiscal 25. So that's part of what is driving that, as well as when redetermination kicked back in post-COVID. Had the impact of just increasing the churn as far as patients that are dropping out of Medicaid and coming back on, just from a documentation point of view. So it's not that they're not eligible for Medicaid, it's just it's supplying the needed documentation in order to make sure that they come back on the rolls.
When was the HBI removed? Was that January of 2025?
That was July of 25.
But we see the significant movement taking place before that, so that doesn't quite address that.
Well, redetermination came back into play, I believe, sometime in 2024. So it's been, it hasn't been isolated just to one particular driver here. It's been kind of compounding impacts of changes.
Okay, thank you.
Yeah, you're welcome.
All right. We good? Any other questions? No. Hearing none. Thank you, Scott. We're going to move right on to the informational report. And this one looks to be specifically on Guidehouse, this is the Guidehouse check-in on our otherwise quarterly contracting update. Is that how we're structuring it, right? So where are we at with Guidehouse?
Winbury, Chief Human Resource Officer. Hello again.
Hello. Sorry.
RJ's gonna run us through, the guidelines.
I'm in a hurry, but I don't want to rush through this. This is very
I
important.
think the information will speak for itself. I think we've made good progress. RJ can walk us through it, and if you have any questions, he will be happy to answer.
Thank you, RJ Dabney, Associate Chief Human Resources Officer. So the HIM coders, pre-registration specialists, and third-party billing representatives remain the highest priority for the revenue cycle AFSCME related to Guidehouse recruitment. So certain actions taken since the last Finance Committee meeting. We have worked to expand the candidate pool by revising the minimum qualifications specifically for the third-party billing representatives. So we've worked with the unions to adjust those minimum qualifications and expand the candidate pool. That has resulted in some great progress with increasing the applicant flow. So prior to this meeting, there were up to 332 applicants, and we've extended another 20 offers. Previously, it was only at 2 prior to since last.
20 is better than 2. That's
20 is a lot better than 2. 10 times better than 2, as a matter of fact. So that was definitely a win in terms of the partnership with the union on the minimum qualifications. We've also worked to streamline recruitment, so all 3 of these roles were put into the accelerated hiring process. And we've also worked with our marketing team to increase visibility of these roles and really target the ideal candidate. So these have been pushed through certain channels. We've launched a revenue cycle landing page, careers landing page on our own career site to highlight these roles and assist with our advertising as well. And we've also developed resources to help internal applicants better navigate the application process, as well as receive notifications for future openings. Next slide.
What degree did you expand the, pool?
So at least an 18% increase of applicant flow so far with some of these efforts.
Do we have a deadline when we need to actually bring in these folks?
So there are targets in terms of the settlement agreement with AFSCME specific to Guidehouse. So those targets are moving away from Guidehouse by the end of the year. Our targets are more in terms of offering to position ourselves to be able to move through that. So far, we've already extended about 1/3 of the offers needed to get to that point out of the 145 openings that we have.
So we're tracking.
We're tracking, yeah.
We weren't
Trending in the right direction.
tracking, now we're tracking.
Now we're trending in the right direction, for sure. So that's what this slide represents. So as I mentioned, we made an update to this slide. So for third-party billing specifically, there represents 2, but we're now up to 25 offers made and 22 offers accepted. Still 1 filled so far, so those will be future start dates. For HIM coders, we have 27 offers accepted. 13 have been filled already. And then for pre-registration specialists, there have been 4 offers accepted. They've all started so far. We are planning a hiring event this month, specifically for third-party billing. So any of the remaining positions that haven't been filled those vacancies will be in that hiring event this month. And we'll continue with our outreach and also development of other pipeline efforts.
But the third-party biller is still the one that's the challenging one.
That had been the challenge, again, because we've relaxed some of those minimum qualifications, and now it's in the accelerated hiring process as well. It's less of a challenge. So again, that's the one that, pretty much has had a significant improvement in applicant flow.
RJ, you said we're at 22 there.
It's
We're
just not,
22 accepted.
but it's not reflected.
No, it's not
Right.
reflected there. He's got it there.
Yeah, that's the update since this slide was presented last year.
Gotcha. All right. Well, then that's significant. That means we're 25% of the way there.
Correct.
Okay. But you still have the.
Still have a ways to go, but with some of the initiatives we have in place, I think we're making strides in the right direction.
Okay. All right. I don't remember, are there specific benchmarks that we're supposed to be meeting along the process, or
No benchmarks along the way besides the one we spoke of in terms of, when the contract with Guidehouse
Okay,
is supposed to
gotcha, gotcha. Are there any questions for RJ on this? All right, well, I look forward to hearing about this again in a couple weeks.
Thank you.
Yep. Thank you. With that, the agenda is exhausted and we are adjourned. Budget, Brett.